the most exciting moment during womanhood is the very start of life within the womb under wedlock. Still exciting is the feeling of the first kick of the fetus aboard. And still more pleasant and comfortable is the stage when your doctor confirms that about the healthy status of the fetus in utero. And I was really fortunate to give that pleasure to many women in our place with the help of ultrasound scan, which I consider as a great privilege. Previously, years back, the only method to find out the presence of fetus in utero, apart from the clinical evaluation, was by X-ray examination, which at times showed the abnormalities of the baby inside. But this was not perfect, and many of the abnormalities in the babies could be missed by X-ray examination. But with the introduction of scanning techniques, it is now possible to find out even minor abnormalities of the baby inside without any bad effects of X-rays. As you are aware, these days no woman delivers without getting a scan done at least once during pregnancy. The presence of pregnancy can be diagnosed as early as 5 days after missing periods. Urine examination of the mother can confirm the presence of pregnancy in the inside the abdomen, but whether it is actually inside the uterus or outside, which you call as ectopic gestation, can be diagnosed only by ultrasonographic evaluation. The movement of the baby can be seen by ultrasound as early as 9 weeks after missing periods, and the presence of limb buds and fetal phase can be diagnosed by 10 to 12 weeks of gestation. Almost all the fetal parts can be seen by 14 weeks of pregnancy, that is by 3 months after missing periods. And most of the abnormalities can be diagnosed as early as 5 weeks of, no, as early as 5 months of gestation. Hence, it is advisable to get a scan done by early pregnancy to diagnose the correct position of the fetus inside the uterus, and a second scan to be done by 20 weeks to exclude most of the abnormalities in the baby. After that, the doctor may ask for many scans to assess the fetal growth as well as to assess the movements, the presence of liquor, whether the fluid surrounding the baby is enough or not, and also to assess the respiratory and nutritional status of the baby. You can do a serial ultrasonographic examination. As you know, the ultrasound examination can be done as a screening test to assess the fetal growth, because here the sound waves which are used for this study do not have any bad effects, unlike X-rays. So it is very safe to use the ultrasound evaluation to assess the fetal growth. Now, for usual ultrasound studies, no special patient preparation is required. You can just visit the sonographic center and get a scan done. In early pregnancy, however, as the uterus and baby is very small, the doctor can ask you to fill up the urinary bladder so that you will get a better visualization of the pelvic organs. But once the uterus is big with the fetal growth, there is no need to fill up the urinary bladder. The patient is put on the table and asked to lie comfortably, and in order to see the baby parts very clearly, the doctor will apply some ultrasound gel on the abdomen, which is helpful to remove the air between the body parts and the transducer, because air will reflect away all the ultrasound waves. A routine examination may take about 15 to 20 minutes, by which time, in most cases, you will get sufficient information about the fetus inside the uterus. Many of the genetic abnormalities may be diagnosed as early as 3 months of pregnancy, not only by ultrasound but by correlation of the ultrasound findings with the other tests, especially the blood test. And at times the doctor may suspect some genetic abnormalities, in which case he will ask for further tests. If everything is comfortable, the doctor will advise you to continue the pregnancy and have a normal life. Of course, the ultrasound findings have to be correlated with other clinical findings like the blood pressure assessment, the blood sugar evaluation, etc. Clinical examination is very important apart from the ultrasound findings. Stop.
Stop ചെയ്തില്ലേ?
ഇല്ല.